Welcome to our channel, where today we delve into a topic that is often shrouded in stigma, yet is crucial for understanding men's health: erections and erectile dysfunction, ED. This subject is not just about physical health. It encompasses emotional well-being, relationships, and overall quality of life. Understanding erectile dysfunction is vital because it affects a significant portion of the male population, with studies indicating that nearly 30 million men in the United States experience some form of ED. This condition can lead to feelings of inadequacy, anxiety, and depression, impacting not only the individual but also their partners and relationships. By discussing this topic openly, we aim to break down the barriers of silence and shame that often surround it, encouraging men to seek help and fostering a healthier dialogue about sexual health. In this episode, we will outline several key topics that are essential for a comprehensive understanding of erectile dysfunction. First, we will explore the anatomy of the male reproductive system, focusing on how erections occur and the physiological processes involved. Understanding the mechanics of erections can help demystify the condition and highlight the complexity of male sexual health. Next, we will delve into the various causes of erectile dysfunction, which can range from physical factors such as cardiovascular disease, diabetes, and hormonal imbalances to psychological issues like stress, anxiety, and depression. By identifying these causes, we can better understand how they contribute to ED and the importance of addressing them holistically. Prevention is another critical aspect we will discuss. Many men may not realize that lifestyle choices play a significant role in sexual health. We will cover practical tips on maintaining a healthy lifestyle, including the importance of regular exercise, a balanced diet, and avoiding smoking and excessive alcohol consumption. Additionally, we will touch on the significance of regular medical checkups to monitor and manage any underlying health conditions that could contribute to erectile dysfunction. As we navigate through these topics, we will also highlight the relevance of erectile dysfunction in today's society. In an age where mental health awareness is on the rise, it is essential to recognize that sexual health is a vital component of overall well-being. The pressures of modern life, coupled with unrealistic portrayals of masculinity in media, can exacerbate feelings of inadequacy and lead to a reluctance to seek help. By addressing erectile dysfunction openly, we can foster a culture of acceptance and support, encouraging men to prioritize their sexual health without fear of judgment. In conclusion, this podcast aims to provide valuable insights into erections and erectile dysfunction, emphasizing the importance of understanding this condition and its impact on men's health. We hope to engage our listeners in a meaningful conversation that not only educates, but also empowers men to take charge of their sexual health. Join us as we explore the anatomy, causes, and prevention of erectile dysfunction, and together, let's break the silence surrounding this important issue. In this segment, we will discuss the anatomy of the penis and its crucial role in the process of erections. Understanding the structure of the penis is fundamental for grasping how erections occur and how various factors can influence erectile function. The penis consists of several key components, with the most significant being the corpora cavernosa and the tunica albuginea. The corpora cavernosa are two cylindrical structures that run along the length of the penis. These spongy tissues are responsible for the majority of the erectile function. When a man becomes sexually aroused, the brain sends signals that lead to the relaxation of the blood vessels supplying the penis, allowing blood to flow into the corpora cavernosa. Surrounding these structures is the tunica albuginea, a tough, fibrous sheath that encases the corpora cavernosa. This tunica plays a vital role in maintaining an erection. As blood fills the corpora cavernosa, the pressure increases, causing the penis to enlarge and become rigid. The tunica albuginea helps to trap the blood within the corpora cavernosa, sustaining the erection. This intricate interplay between the blood vessels, the corpora cavernosa, and the tunica albuginea is essential for achieving and maintaining an erection. Blood flow is a critical factor in the erection process. When a man is sexually stimulated, the body releases nitric oxide, a chemical that relaxes the smooth muscles in the blood vessels of the penis. This relaxation allows for increased blood flow into the corpora cavernosa. As the blood fills these structures, they expand, and the pressure within them rises, leading to an erection. Conversely, when the stimulation ceases, the blood vessels constrict, and blood flow decreases, resulting in the penis returning to its flaccid state. This process highlights the importance of both the vascular system and the nervous system in achieving an erection. Understanding the anatomy of the penis and the mechanics of erections is particularly significant when addressing erectile dysfunction. Many men may experience ED due to a variety of factors, including physical conditions such as diabetes, hypertension, or cardiovascular disease, which can impair blood flow. Psychological factors such as anxiety or depression can also disrupt the signals necessary for achieving an erection. By comprehending the anatomical structures involved and how they function, men can better understand the potential causes of their erectile dysfunction and seek appropriate treatment. Moreover, knowledge of penile anatomy can empower men to engage in conversations with healthcare providers about their sexual health. It can help demystify the condition and reduce the stigma associated with discussing erectile issues. When men are informed about how their bodies work, they are more likely to seek help and explore treatment options, whether that involves lifestyle changes, therapy, or medical interventions. In summary, the anatomy of the penis, particularly the role of the corpora cavernosa and the tunica albuginea, is fundamental to understanding how erections occur. The process of blood flow and its significance in achieving an erection cannot be overstated. By gaining insight into these anatomical and physiological aspects, men can better address erectile dysfunction and take proactive steps toward improving their sexual health. This knowledge not only fosters a greater understanding of their bodies, but also encourages open discussions about sexual health, ultimately leading to better outcomes and enhanced well-being. In this section, we will explore the 3 different types of erections: reflexive, psychogenic, and nocturnal. Each type plays a unique role in male sexual function and is governed by distinct physiological processes. Understanding these types is essential for comprehending how erections occur and how various factors can influence erectile function. Reflexive erections are primarily triggered by physical stimulation. This type of erection occurs when sensory nerves in the penis are stimulated, sending signals to the spinal cord, which then relays messages back to the blood vessels in the penis. This process leads to the relaxation of smooth muscles and increased blood flow into the corpora cavernosa, resulting in an erection. Reflexive erections can occur even in the absence of sexual arousal or psychological stimulation, making them a vital aspect of male sexual health. For instance, they can be elicited through direct physical contact, such as during masturbation, or other forms of tactile stimulation. This type of erection is particularly important in understanding erectile function, especially in cases where psychological factors may hinder sexual arousal. Psychogenic erections, on the other hand, are initiated by psychological stimuli rather than physical sensations. These erections are influenced by thoughts, fantasies, or visual stimuli that evoke sexual arousal. The brain plays a crucial role in this process, as it sends signals through the nervous system to the blood vessels in the penis. When a man experiences sexual excitement due to mental or emotional triggers, the brain releases neurotransmitters that promote blood flow to the penis, leading to an erection. Psychogenic erections highlight the intricate connection between mental health and sexual function. Factors such as stress, anxiety, or depression can significantly impact a man's ability to achieve a psychogenic erection, making it essential to address psychological well-being when discussing erectile dysfunction. Nocturnal erections, also known as sleep-related erections, occur during the rapid eye movement (REM) stage of sleep. These erections are a normal physiological response and can happen multiple times throughout the night, even in men who may not be sexually aroused. Nocturnal erections are believed to serve several purposes, including maintaining penile health by ensuring adequate blood flow to the tissues and preventing fibrosis. The physiological processes behind nocturnal erections involve the same mechanisms as reflexive and psychogenic erections, with the brain and nervous system playing key roles. The presence of nocturnal erections is often used as an indicator of healthy erectile function. If a man experiences these erections during sleep, It suggests that the physiological mechanisms for achieving an erection are intact, even if he struggles with erections during waking hours. Recognizing these three types of erections is crucial for understanding erectile function and addressing erectile dysfunction. Each type serves as a window into different aspects of male sexual health. For instance, if a man can achieve reflexive erections but struggles with psychogenic erections, it may indicate that psychological factors are at play. Conversely, the presence of nocturnal erections can help differentiate between psychological and physiological causes of erectile dysfunction. By understanding these distinctions, men can better communicate with healthcare providers about their experiences and seek appropriate treatment options. In summary, reflexive, psychogenic, and nocturnal erections each play a vital role in male sexual function. The physiological processes behind these types of erections highlight the complex interplay between the nervous system, blood flow, and psychological factors. Recognizing and understanding these types is essential for addressing erectile dysfunction and promoting overall sexual health, empowering men to take charge of their well-being and seek the help they may need. Erectile dysfunction, ED, is a complex condition that can arise from a variety of causes, which can be broadly categorized into psychogenic and organic factors. Understanding these causes is essential for effectively addressing and treating ED, as they can significantly influence a man's sexual health and overall well-being. Psychogenic causes of erectile dysfunction are primarily rooted in psychological factors. These can include anxiety, depression, stress, and relationship issues. Anxiety, particularly performance anxiety, can create a vicious cycle where the fear of not being able to achieve or maintain an erection leads to increased stress and further difficulties in sexual performance. This anxiety can stem from various sources, such as past experiences, societal pressures, or unrealistic expectations about sexual performance. Depression is another significant psychological factor that can contribute to ED. It often leads to a decreased interest in sexual activity and can affect a man's ability to become aroused. Additionally, relationship problems, such as lack of communication or unresolved conflicts with a partner, can exacerbate feelings of inadequacy and contribute to erectile dysfunction. Recognizing these psychogenic factors is crucial, as they can often be addressed through therapy, counseling, or lifestyle changes, leading to improved sexual function. On the other hand, organic causes of erectile dysfunction are related to physical health and medical conditions. These causes can be more straightforward to identify and often involve physiological issues that affect blood flow, nerve function, or hormone levels. One of the most significant organic causes of ED is vascular health. Conditions such as atherosclerosis, hypertension, and diabetes can impair blood flow to the penis, making it difficult to achieve or maintain an erection. Atherosclerosis, for instance, involves the buildup of plaque in the arteries, which can restrict blood flow throughout the body, including the penile arteries. Similarly, diabetes can lead to nerve damage and poor circulation, both of which can contribute to erectile dysfunction. Hormonal imbalances can also play a role in organic erectile dysfunction. Low testosterone levels, for example, can lead to reduced libido and difficulties in achieving erections. Other medical conditions, such as thyroid disorders or prostate issues, can further complicate erectile function. Additionally, certain medications used to treat various health conditions may have side effects that include erectile dysfunction, making it essential for men to discuss their medications with their healthcare providers. The interplay between psychological and organic causes of erectile dysfunction is also noteworthy. For instance, a man with a medical condition that causes ED may develop anxiety or depression as a result, creating a cycle that exacerbates the problem. Conversely, psychological issues can lead to physical changes in the body that contribute to erectile dysfunction. This interconnectedness underscores the importance of a comprehensive approach to treatment that addresses both the psychological and physical aspects of the condition. In summary, erectile dysfunction can arise from a variety of causes, which can be classified into psychogenic and organic factors. Psychological issues such as anxiety and depression can significantly impact a man's ability to achieve and maintain an erection, while organic causes related to vascular health and medical conditions can create physiological barriers to erectile function. Understanding these causes is crucial for effective diagnosis and treatment, as addressing both the mental and physical aspects of erectile dysfunction can lead to improved outcomes and enhanced quality of life for men experiencing this condition. By fostering open discussions about these issues, we can help reduce stigma and encourage men to seek the support they need for their sexual health. Erectile dysfunction, ED, is not solely a physical issue. It is often deeply intertwined with psychological factors that can significantly impact a man's sexual health. Among these psychological factors, performance anxiety and relationship issues are particularly influential, contributing to the onset and persistence of erectile dysfunction. Understanding these elements is crucial for addressing ED effectively. Performance anxiety is a common psychological barrier that many men face when it comes to sexual activity. This anxiety often stems from the fear of not being able to perform adequately, which can create a self-fulfilling prophecy. When a man becomes overly concerned about his ability to achieve or maintain an erection, the pressure can lead to heightened stress and anxiety, making it even more difficult to perform. This cycle can be exacerbated by societal expectations and cultural norms that equate masculinity with sexual prowess. As a result, the fear of failure can overshadow the enjoyment of intimacy, leading to avoidance of sexual situations altogether. This avoidance can further entrench feelings of inadequacy and anxiety, creating a vicious cycle that can be challenging to break. Relationship issues also play a significant role in the psychological landscape of erectile dysfunction. Poor communication, unresolved conflicts, or lack of emotional intimacy with a partner can contribute to feelings of insecurity and anxiety during sexual encounters. If a man feels disconnected from his partner or perceives that there are unresolved issues in the relationship, it can create a mental block that hinders sexual arousal. Additionally, if a partner expresses frustration or disappointment regarding erectile difficulties, it can amplify feelings of shame and inadequacy, further complicating the situation. Addressing these relationship dynamics is essential for improving sexual function and overall relationship satisfaction. In summary, preventing and reversing erectile dysfunction involves a comprehensive approach that addresses underlying health issues, promotes regular exercise and a balanced diet, and emphasizes the importance of sleep and stress management. By taking actionable steps in these areas, individuals can significantly improve their erectile function and overall quality of life. Prioritizing health and well-being not only enhances sexual health, but also fosters a greater sense of confidence and fulfillment in intimate relationships. Empowering oneself with knowledge and proactive strategies can lead to lasting improvements in sexual health and overall wellness. In this podcast, we have explored the multifaceted topic of erectile dysfunction, ED, emphasizing the importance of understanding this condition and its various causes. Erectile dysfunction is not just a physical issue. It encompasses psychological, lifestyle, and medical factors that can significantly impact a man's sexual health and overall quality of life. By delving into the complexities of ED, we aim to break down the stigma surrounding it and encourage open discussions about sexual health. One of the key points discussed is the differentiation between psychogenic and organic causes of erectile dysfunction. Psychogenic factors, such as performance anxiety, depression, and relationship issues, can create significant barriers to achieving and maintaining an erection. On the other hand, organic causes, including vascular health issues, hormonal imbalances, and the side effects of certain medications, can also play a critical role in erectile dysfunction. Understanding these causes is essential for identifying effective treatment options and addressing the underlying issues that may contribute to ED. We also highlighted the impact of lifestyle choices on erectile function. Factors such as smoking, excessive alcohol consumption, poor diet, and lack of exercise can all contribute to erectile dysfunction. Conversely, adopting healthier habits, such as regular physical activity, a balanced diet rich in nutrients, and stress management techniques, can significantly improve sexual health. By prioritizing these lifestyle changes, individuals can take proactive steps toward preventing and reversing erectile dysfunction. Additionally, we discussed the relationship between pornography use and erectile dysfunction, emphasizing the importance of mindful consumption. While pornography can be a source of sexual exploration, excessive use may lead to unrealistic expectations and difficulties in real-life sexual encounters. Encouraging open communication with partners about pornography consumption can foster healthier relationships and enhance sexual satisfaction. Throughout the podcast, we reiterated the significance of treating underlying health issues that may contribute to erectile dysfunction. Regular checkups with healthcare providers can help identify and manage conditions such as diabetes, hypertension, and hormonal imbalances, which are crucial for maintaining erectile function. By addressing these health concerns, individuals can create a solid foundation for improved sexual health. As we conclude this episode, we encourage our listeners to take proactive steps toward improving their sexual health. Whether it involves seeking medical advice, making lifestyle changes, or engaging in open conversations with partners, taking action is vital for addressing erectile dysfunction. Remember, you are not alone in this journey, and there are resources available to help you navigate these challenges. Finally, we invite you to subscribe to our podcast, like our content, and share it with others who may benefit from this information. By spreading awareness and education about erectile dysfunction, we can help reduce stigma and empower individuals to take charge of their sexual health. Together, we can foster a supportive community that prioritizes open dialogue and understanding around sexual health issues. Thank you for joining us in this important conversation, and we look forward to continuing to explore topics that matter to you in future episodes.